Hello everyone. Today we are going to discuss about skin lesions. I am Mrs. Jansi, working as a clinical instructor at Triple M College of Nursing. Today, let's see the objectives of the discussion. At the end of the session, the learner will be able to differentiate the primary and the secondary lesions in detail. So what are primary lesions? So as discussed earlier in the assessment, we have seen primary lesion, secondary lesion, and complex lesions. So first, let's discuss about the primary lesion. First, it's macule. What is macule? Macule is a flat skin lesion which is less than 1 centimeter in size that differs in color from surrounding skin. That is, for example, freckle, also seen in psoriasis, versicolor, and nevus pilis. This is tinea versicolor. These both are tinea versicolor, and this is the nevus pilis. Next is patch. What is a patch? Patch is a flat skin lesion that's also more than 1 centimeter in size that differs in color from the surrounding skin. You can see the difference in the normal skin color. This is congenital nevi and this is tinea capitis. Next, we are going to discuss about the papule. Papule is nothing but a small palpable skin lesion which is 1 centimeter in diameter. For example, it's seen in lichen planus, molluscum contagiosum, neurofibromatosis, type 1, and acne. This is an example of acne, and this is an example of lichen planus. Next is nodule. So what is nodule? Nodule is nothing but an elevated lesion in both diameter and depth. For example, this is erythema nodosum. You could see here the elevated lesion, which is more than 1 centimeter in its size. And here, this is a squamous cell carcinoma. This is an example of squamous cell carcinoma. Plaque. What is plaque? Plaque is nothing but a palpable, usually raised lesion, which is more than 1 centimeter again. So this is seen in pigmented basal cell carcinoma. BCC is nothing but the basal cell carcinoma, tyriasis rosacea, necrobiosis, lipodacea, and psoriasis. So pigmented basal cell carcinoma, this is an example. Next is a vesicle. What is vesicle? Vesicle is nothing but a small fluid-filled lesions. Okay, so it's containing a blister with fluid in it. Okay, so examples are eczema, herpeticum, chickenpox, herpes zoster. So this is a typical example of a chickenpox. This is eczema, and this is the example of herpes zoster. Next is bulla. Bulla is nothing but a large fluid which contains blister. So this is nothing but the large fluid which is containing blister in it. This is known as bulla or the bullous pygmoid and Stevens-Johnson syndrome. This is an example of Stevens-Johnson syndrome, and this is an example of pemphigoid bullous. Next primary lesion is wheal. Wheal is nothing but a well-circumscribed pruritic and erythematous papule or plaque with dermal edema and irregular borders. You could not see or find any borders here. Without borders that spreads across the body. All throughout the day, hours to days, it's very transient and spreads very easily. So this is known as wheal. This is an example of a urticaria. Next is pustule. What is pustule? As the name indicates, it is a vesicle which is filled with the pus within it. So this is seen in the pustular psoriasis. This is an example of pustular psoriasis. You could see the pus inside, and then this is a complete psoriasis. So before we go into the secondary lesions, we will just see what all we had discussed. So we had seen about the macule, patch, papule, nodule, plaque, vesicle, bulla, and wheal. These are the primary lesions. Now let's go into secondary lesions. So what are the secondary lesions? Let's see that in detail. So this is scale. It's nothing but the scale. So this is a thickened stratum corneum. Scales are very flaky, dry, and usually whitish in color. In contrast, crusts are more often moist and yellowish or brown in color. For example, it's seen in ichthyosis vulgaris. This is the ichthyosis vulgaris, and this is a typical example of squamous cell carcinoma. And you can also find the scales in eczema and psoriasis. Secondary lesions, we are going to see the next one as the crust. Crust is nothing but a dried exudates, such as pus or blood. You could see here, these are the dried exudates which has pus and blood in it. So these are seen in atopic dermatitis or non-bullous impetigo. Crusts are seen in atopic dermatitis and non-bullous impetigo. Next is a fissure. Fissure is nothing but the linear crack through the epidermis that extends into the dermis. Fissure is nothing but the linear crack. As you see here, this is the linear cracks. So this extends into the dermis layer through the epidermal layer. Next is ulcer. Ulcer is nothing but a rounded or irregularly shaped. It doesn't have a regular shape. So it is irregularly shaped with deeper lesion in it that results from the loss of epidermis and some portion of the dermis is missing. So this is a typical example of the ulcer. Next is erosion. Erosion is nothing but loss of all or portions of the epidermis. Erosion is nothing but a loss of all the portion or the part of the epidermis. For example, angular stomatitis. For example, you could see that in angular stomatitis. Angular, this is the example of angular stomatitis. So next we are going to see excoriation. Excoriation is nothing but the abrasion which is produced by mechanical force, usually involving the dermis, but may reach out the layer of the dermis. So this is an example of tinea corporis or the ringworm infection which is spread through excoriation. Next is necrosis. Necrosis is nothing but, as the name indicates, it is a dead skin tissue. So you could see the best example is the dry gangrenous area because of the death of the skin tissue or the blood supply. Because of that, you could see the dry gangrene in the patients. Next is skin atrophy. Skin atrophy is nothing but the thinning of the skin without any inflammation. For example, skin atrophy, you can see here, there will be thinning of the skin, but there won't be any inflammation in it. Next is a scar. For scar, the best example is keloid. You could see keloid just growing on spreading across beneath the skin. So it is composed of new connective tissue that has replaced lost substances. An overgrowth of the scar tissue manifests as a keloid. It is nothing but the overgrowth of the scar tissue, which is manifesting as a keloid. That is thickened raised tissue. As you see here, it is a thickened raised tissue that grows beyond the borders of the scar and shows no regression in it. Hope you all understood. I would like to conclude my topic. So far, we had discussed about the primary lesions. Primary lesions, we had seen about macule, papule, patch, nodule, plaque, vesicle, bulla, wheal, and pustule. Under secondary lesions, we had also discussed about scale, crust, fissure, ulcer, erosion, excoriation, necrosis, skin atrophy, and scar. So these skin lesions are very common presentation in the primary care setting, many of which can be very easily diagnosed based on the history and the clinical examination properly. If we identify, then we could easily diagnose what you can easily differentiate and diagnose what are the primary category and what are coming under the secondary category, and you can treat accordingly. So these are some of the references which I had used. Hope it's clear. Thank you. See you in next class.